Going ahead to HU and CT. All right, so attempt this question and then we'll talk. 15 seconds. Okay, so 42% getting it correct. So again, H may, who is H in HU? Do we know him? Have we talked about him yesterday? Yeah, so he's Hounsfield. All right, yeah, he's Hounsfield, as all of your Adha naam you are saying. Hounsfield is the person, Godfrey Hounsfield, who discovered CT along with Alan Cormack. All right, so based on him, to give him respect, we call all of these units Hounsfield units, and they're just numbers to tell you कुछ काला है कुछ सफेद है. It look very weird, no? If you and I discuss कि ये CT में काला है, ये CT में सफेद है, it is white, it is black, it so seems very ऐसा ना, uneducated and racist also. Yes. So basically, to avoid that, what we'll do is we'll give it a number. Okay, we give that kala to make racism more objective. We give it a number, right? So that number basically, what is the number? Yes. So the starting point. This is the baseline color. This is the baseline color, which is what? Which is 0, which is water. Very good. It is distilled water that is given a Hounsfield unit of 0. Okay, so anything which is kala than water, blacker than water gets an HU of minus, or anything which is whiter than water gets an HU of positive. So this is hypodense, this is hyperdense. Got it? So now, what is water? What does water look like? So look here, this is a cross section of the abdomen, and I'm showing you the stomach here. Can you see this person must have drank some water? So this is the water ka color I'm able to pick up here. Everybody is feeling fine ki water aisa gray hai. ठीक है. Now pick out two things here in the same section which are kala than water, which are blacker than water. One is here, one is here. I have found the two stuff for you. Now tell me what is what, which is more kala, which is this which deserves a -1000, सबसे blackest possible thing. Very good. So this is air which you are seeing in the lung, in the base of the lung, which are coming in this section. What is this kala? All of us have it. Some have it more, some have it less. It is fat, right? So this is the subcutaneous fat that you have. Again, can I say fat is also black, but it is not as black as air, right? So can I give it an HU of -10 to -100? Yeah, so I do that. So this is about two things. So always they'll ask you what are the two things which have a negative HU on CT, and we'll say that it's fat and it's air. Got it? Now coming to positive side of things. So this is water. Can you see all the muscles are slightly whiter? They're still gray, but they're slightly whiter than that of the fluid. So 20 to 30 becomes our soft tissue. All your soft tissue, which is muscles, which is your any organ when we don't give contrast. So on a non-contrast CT, all of these organs will look the same as muscles, right? So all of your soft tissue will be 20 to 30. What is 60 to 90? So now things are going to become much whiter. Okay, we are going into whiter side of things. Very good. So this is very important. This is acute bleed. This is acute hemorrhage. So first pointer everybody puts in their mind, NCCT, best for acute hemorrhage. Just ask yourself anytime they ask you any question, are we trying to look for acute bleed? If yes, what will be your answer? Your answer will be a CT scan. And what kind of a CT scan? Do I need to give contrast? Because this is anyways white. One thing is anyways white, we don't want to give contrast. So is this concept clear? Anytime I want to see any sort of acute hemorrhage, I go for non-contrast CT. Where all? We will just see. Okay, going ahead. 200 to 300, this is that contrast we are talking about. This is that iodinated contrast, which is going to be quite white. Do you see this? In the mediastinal vessels, we are seeing this very white contrast. So it is quite white. Okay, then when we go subse white, what is subse white that you are seeing here? That is how we identify ki bones are white, means it is CT, right? So plus 1000 you give to bone. Bone is made up of calcium. Can I say calcification will be also itna white? Yeah, you can say that. So again, one more funda goes in my head. If I want to pick up any sort of calcification, what will I do? I will do a non-contrast CT, right? I don't need to give contrast. It is anyways white. If I want to pick up bone, bone में क्या white है? बताओ जरा. Bone cortex or bone marrow? What is the thing which has calcium? It is the cortex or the marrow? Yes, very good. It's the cortex which has the calcium. Marrow में तो fat है, hematopoietic cells है, right? So it's bone cortex. So if I tell you I want to see fractures in the cortex, if I want to see cortex, ऐसे then what will I do? I'll do NCCT. But if I want to see bone marrow, will CT be my answer? No, then I can't rely on CT because CT is not showing me bone marrow. MRI is showing me bone marrow. Are all of these concepts going inside the mind? Okay, so ये रटना नहीं है last day पे, ये भी absorb. Okay, all right. And one more thing, what is it which doesn't even fit in the scale, which is so wide that it goes beyond? It is plus 1000 and I don't have any value to define it. Very nice. It is metallic foreign body. So metallic foreign body goes beyond the scale. वो 1000 के भी ऊपर है. That is why it will produce a streaking. जहाँ पे भी जाएगा halo, it'll have halo. It is so white that it creates a streak around it. Okay, so remember foreign body. Again, tell me, anytime I want to see metallic foreign body, have we been through this? It is so white. Do I need to give contrast? I don't. And CT is showing me white, so CT will be my answer. Yes, so can I just summarize when I want to see three things? One, acute hemorrhage, right? Acute hemorrhage. Again, I can pick up NCCT. If I want to look at calcification or I want to look at bone cortex, again I can go for NCCT because ये सारे खुद में काफी white है, so I can pick it up. Yeah, and calcification से you remember calculi also, right? You remember calculi which are made of calcium, radio opaque calculi which are your renal calculi. Are GB calculi radio opaque? Are they made up of calcium? No, not really. Only 10%, right? So GB calculi, we are not concerned with NCCT, but renal calculi, we are. Okay, going ahead. What was the third thing? Metallic foreign body, right? So any metal, NCCT. Is this clear? So is this fine, everyone? So this is about for renal calculi, Rajat. Investigation of choice, NCCT. Gallbladder calculi, ultrasound, right? Is that clear? So stress fracture is one exception, right? So we'll talk about it. All cortex, but stress fractures, all right? Because stress fractures always will not have a cortical break. मैं खाली इसमें cortical breach देख सकती हूँ that this is the cortex which is fractured. Stress fracture, we don't see that a lot of times. So that is why MRI. Because again, what do I want to see in stress fracture? End of the day, concept बताओ क्या area देखना है? I want to see edema. Very good. I want to see bone marrow edema. And bone marrow आते ही, I know I have absorbed it. It is MRI. Got it? Everyone, are the concepts building? जिनके बने हुए थे उनके strong हो रहे हैं. Yeah. So now going back. Air minus 1000. True or false? Is this true or is this false? This is true. Fat 0 to 20. Is this true? Is this false? This is false. Can I say anything which has an HU of 0 to 20? What is the nature of it? Can you tell me? I measure, there's a lesion in the kidney. There's a lesion in the kidney. I measure it. It shows me an HU of 10. What does it tell me? Yes, it is white. That's okay. But what is it made up of? Soft tissue. Are you sure? Are you sure 10 is soft tissue? It was starting from 20 onwards, guys. So 0 to 20 mane water. See, 0 was distilled water. So can I say any sort of other water should be 0 to 20? Yeah. So can I say this is filled with fluid? It is filled with fluid. So it can be cyst. Yeah. A lot of you are saying pus also. Yeah. But can I just say that it's a cystic lesion? And then what do I do? What is the investigation of choice to delineate, characterize a cyst? Very good. Then I do an ultrasound and I see ki pura anechoic hai or it has abscess like echoes. Got it? Did you guys understand? So remember 0 to 20 mane pani. Okay. Got it? Cyst. All right. Acute hemorrhage 80 to 90. ठीक है. Bone 800 to 1000. ठीक है. So fat is gonna be negative. Everything else here is right. Got it, everyone? So shall I move ahead? What is this? So again, very hyper attenuation, same thing. So hyper dense, hyper attenuating, everything is fine. No. Who asked flare is good for bone marrow edema? Let's talk. All right. When we go to MR, I'll just remind me if I forget. Very good. So all of you are giving me the diagnosis also. So this is a high resolution CT. Okay. So remember, for high resolution CT, we use a bone algorithm. We use a high intensity bony algorithm. Okay. It is also called as a sharp reconstruction. So in case you hear these words, these are used for high resolution CT, which give it these very sharp bony images. So here the thumb rules are what? Yes, it will be in the lung. It will be your answer for two things. One is any sort of ILD, right? Any sort of ILD. What are the types of ILDs? We will study when we go to RESPI, if we go to RESPI. And the other thing, bronchiectasis, right? So both of these, remember the thumb rules, multiple times asked. ये सवाल FMG exam में हजारों बार आया है, right? Difference between UIP, IPF, no determination. Everything, both are the same entity. So radiologists, clinically we call it UIP. Pathologists call it IPF. Okay. Yeah. So yes, now very good. COVID-19 also, can you say investigation of choices as HRCT? Everyone? Yeah, I can say that. Okay. Apart from that. Okay, so sharp money. So there are various kinds of reconstructions. All right, there are various kinds of reconstructions from mediastinum, from soft tissue, from bone, and they have a range. All right, so just remember that in the sharper side of things, so that we get this higher resolution, we use a sharp reconstruction. It's a technical term for the machine. Okay, apart from this, when I talk about bone, okay, when I talk about bone, all right, so what will be the two areas? One will be the paranasal sinus, all right, this was your last year ka question. The other would be temporal bone, right? So temporal bone fractures, temporal bone pathologies, everything will be this. So this high resolution CT. Okay, so Mackie is asking CCT versus HRCT. So remember, both can be done at the same time. High resolution CT is the thing that we do to look at the lungs. Remember this image. How are the lungs looking? They are looking pitch black. Can I identify honeycombing? Can I identify bronchiectasis from this black window? No. So we are not taking a new sequence. What I do is I just adjust the machine parameters such that I can see the lungs better and everything else becomes wider. This is called as window. This is called as windowing. So we have lung window, we have bone window, so depending on the window, basically, this is how we do. Difference between MRI and CT, Azam, we look at the bones. If the bone cortex is white, it is CT. If it is black, it is MR. Okay, everyone, is this clear? So this is your lung window, wherein everything else will be safed, but just my lungs will be the focus area. All right. Okay. So this is high resolution CT. Okay. Oh, all right. So now going and consolidating the thumb rules. Non-contrast CT, investigation of choice for head and spine trauma. Head trauma. Why? Spine trauma. One common theme. Both of them, I want to see fractures. Do you agree? Second, in the head, do I want to pick out acute hemorrhage? Do I want to pick out acute EDH, SDH, intraparenchymal hemorrhage? So again, acute hemorrhage. So answer NCCT. Acute SH, any kind of hemorrhage, चाहे वो SAH हो, IVH हो, कोई भी H हो, acute H, answer is NCCT. Intracranial calcification, does it make sense? Okay, so does higher resolution CT means higher radiation than normal CT? Slightly. All right, so it has a slightly higher dose, all right, as compared to a normal CT that we would do. All right, so in the lung, we usually have two kinds of CTs. We can do a low dose CT, we can do a normal CT. Okay, so HRCT is usually done as a part of that. Okay, so slightly higher. Got it, everyone? When we use CCT, I'll come to that. All right, I'll come to that. Don't worry. Algorithm and window, they are not the same, Sahitya. A lot of radio questions. Okay, so they are not the same. They are different features. Okay, right. So now going ahead, पहले thumb rules पढ़ लो, धीरे-धीरे सारे जवाब के आंसर दूंगी. Okay, then we have renal calculi. All right, so renal calculi again radio opaque, so NCCT. Intraocular foreign body, again this. Even salivary gland stones, all right, even salivary gland stones can be picked up on NCCT, right? Just the stones, but everything else about the salivary gland we can't know on CT. So the salivary calculi we can definitely do. Okay, right. Bone cortex, stroke. Again, stroke initial investigation. Why so, guys? What do we want to do? Yes, again, to rule out hemorrhage. I want to rule out hemorrhagic stroke so that I can start the patient on thrombolysis, right? That is the management of stroke. So that we can start on IV TPA. I just want to rule out a hemorrhagic stroke. That is why. Intraocular foreign body. This we have already discussed, right? So intraocular foreign body, best investigation. Is this clear? ये रटना पड़ेगा list, guys. ये रटना पड़ेगा, नहीं रटना पड़ेगा. Q is a previous year question. Q is a previous year question. Okay, so ये है question आपका. All right. Okay. So now one of you had asked how to distinguish CT and MR. So now you tell me, is this CT or is this MR? Is this CT or is this MR? So here the bone is white, bone cortex is white. This is CT. Here can you see कि पीछे का जो white rim है, that is not the bone, all right? So don't confuse that with the bone, that is the scalp fat. What I see inside, this is the bone and that appears black. This is MRI. So CT versus MR is done. Now we go on to MRI sequences. So 2 main sequences and then we modify it. Okay, then we learn more. So here we have T1, we have T2. What is the first rule? How do you start? The easiest to diagnose, सबसे पहले rule out करो कि T2 है या नहीं. Okay, so how to diagnose T2? Very nice. World War II. So World War II is going to be water is white on T2. If I find that it's a T2 weighted sequence, I will have that CSF in the sulcal spaces in the cisterns will be white. What about gray matter, white matter? What will happen to gray matter, white matter? I will see that the white matter is actually darker than the gray matter. नाम से उल्टा है. नहीं, that gray matter is actually white and white matter is actually gray. So नाम पे stick नहीं करता. Should I give it first rank or second rank when it's not true to its words? Second, you are T2. Alright, you are T2. But when it says that my name is gray matter and I'm going to appear gray and my name is white matter and I'm going to appear white, what do we tell it? We tell it you are 1. Okay, you are going to be my T1 weighted sequence. Yeah, everyone. So let's confirm. This is the white matter. Andar ka part. Is it whiter? Yeah. Is this gray? Yes, it is gray. So it's sticking to its name. And how is the CSF? CSF is dark. Okay, so everything is fitting. This is a T1 weighted sequence. Now when life gives you dhoka, when life tells you that CSF is black, but gray matter, white matter is like a T2. Then what is that sequence? When this is like this, but CSF is black. What is that? Very good. That sequence is called flare. Now, what is flare? So flare is a sequence which is fluid attenuated. Inversion recovery. Attenuate matlab suppress. To suppress anything you can attenuate kar do isko. Right. So we are doing the sequence to only attenuate fluid. It's a T2 weighted sequence only. But हमने CSF को बोला that you please be silent. Alright, we kill the CSF. So CSF will be black, but every other property will be like T2. Now, one more substance was hindering me where it is white on T1, it is white on T2. What is that thing? जो सब में white दिखती है. Everybody has it. Some have it more, some have it less. What is that thing? जो सब में है. T1 में भी white है, T2 में भी white है. ये क्या है बाहर का stuff? Is it the scalp fat? Is it the scalp fat which is white on T1, white on T2? Can I say fat is something which is gonna be white on T1 also, white on T2 also? Yeah. So now on T2, we have fat which is white, we have fluid which is white. Do you all agree कि T2 पे water is also white, fat is also white. Now what happened? This came into a picture and we were in trouble when we wanted to see bone marrow. Remember, सबने याद तो कर लिया कि bone marrow equals MRI, M for marrow, M for MR. But the problem was bone marrow has what? Bone marrow has fat. Yeah, bone marrow has fat. Now fat is white and my edema is also going to be white. तो अब problem हो गया. How to identify? So now we thought, okay, like we discovered flare, let me discover a stir. Stir में कोई fat तो नहीं है. It stands for short tau inversion recovery. They will not ask you this, but if you want to know, it stands for short tau inversion recovery. But what are we doing? It is again a T2 weighted sequence, but what am I subtracting? मैंने बोला fat, kill fat. So we suppress the fat. So now what will happen? Any edema that I want to see will stand out. Do you agree? In flare, I can pick out brain edema. Brain pathology is very nicely. Here, I can pick out bone marrow edema very nicely. Do you agree? So when they ask you investigation of choice or sequence of choice, when I want to pick up brain pathologies, brain edema, flare. When they ask you sequence of choice, when I want to see bone marrow edema, अलग फॉर्म में can I say when I want to pick up stress fracture, अलग फॉर्म में can I say when I want to pick out acute osteomyelitis, still I am picking out edema only. What else can I ask you about this? So any sort of bone marrow edema that they ask you, if they ask you sacroiliitis, inflammation देखना है, still can you tell me that stir is my guy, short tau inversion recovery? All right, CSF will be like T2 in stir. Yeah, in stir we are not suppressing CSF, so CSF will be white. Okay, yes, bone marrow infarcts also, everything. Okay, got it guys, got the concept. So bone में stir, brain में flare. One of you had asked this. Is that doubt clear? Then और भी sequences है हमारे पास. One of the sequences is called diffusion weighted imaging. One is called susceptibility weighted imaging. Now, what is diffusion weighted imaging? So what diffuses in our body? What was that which was spinning and giving rise to all the sequences? Tell me, कल क्या spin कर रहा था? Protons. Water have a lot of protons. right? So water keeps diffusing everywhere in a Brownian motion. All right, so Brownian motion is random. ये definition पढ़ते थे +2 में, that Brownian motion is random in all directions, right? So basically, what if that random direction, all of us want to be very free in life, we want to move around randomly minding our own business, but what if there are too many people in the house? When there are too many people in the house, when there are too many cells in the room, what is going to happen? Is that motion going to be restricted? Will you keep bumping into people in your own house? Yeah, lockdown story. Yes, so in lockdown, is your diffusion restricted? All you guys, restricted hai na? So that is called diffusion restriction. So tell me, what all conditions will cause diffusion restriction? Too many cells? Yeah, when there are too many cells, again your diffusion will be restricted. So one, hypercellular tumors, can I say that बहुत सारे cells हो गए, tumor है, right? So diffusion is restricted. Then when I tell you infarct हुआ, all of you guys in your home, you are 5 people only, but because of lockdown, you got very fat. All 5 of you got very, very fat, which is cytotoxic edema in stroke. Again, your diffusion will be restricted. All of you are occupying a lot of space. तो फिर से टकराओगे एक दूसरे में, right? So this is again restricted diffusion. So can I say in all cases of cytotoxic edema, which happens where? Where does cytotoxic edema happen? Stroke, infarct mein, right? So in infarct, again, can I say there's going to be diffusion restriction? Acute infarct. And is this the best sequence for acute infarct? Most sensitive? Yes, because it picks up this motapa the earliest. Everything else, every other sequence will take a lot of time, but this motapa, this cytotoxic edema, is an earliest property that you can pick up. So remember, sequence of choice for cytotoxic edema is diffusion weighted imaging. Got it? Apart from that, what about abscess? Abscess mein you don't have cells only, you have this thick pus which is collecting. Again, will you have diffusion restriction? Yes. Apart from that, when you have thick keratin which is accumulated, like epidermoid cyst, again, will you have diffusion restriction? Any thick pultaceous material? Can I also say cholesteatoma can also have this? Cholesteatoma also has this. In the jaw, there is one keratinous tumor. Tell me the name of that tumor. It starts with keratin. I'll give you that hint. Very good. KOT. It's called keratocystic odontogenic tumor, not ameloblastoma. So KOT. Can I again say it will show diffusion restriction? Yeah, it is associated with Gorlin-Gott syndrome. Very nice. Okay, so these are the conditions which will all show diffusion restriction. Is this clear, everyone? So this takes care of everything that you need to know about DWI. Now, SWI. SWI is susceptibility weighted imaging. One of you asked, is DWI a T2 weighted sequence? Yes. In its core, in the heart, it's basically a T2 weighted sequence, but we modify it. All right. So it's a different kind of sequence, but it's a T2 weighted at the heart. Okay. Arachnoid cyst will not show diffusion restriction. That is how you distinguish it from epidermoid. It will not show diffusion restriction. Okay. KOT, Gorlin. So Bhargavi, this is a syndrome, Gorlin-Gott syndrome, which is associated with these keratocystic odontogenic tumors of the jaw. Okay, everyone, are you guys fine? So susceptibility weighted imaging. Susceptibility weighted imaging का एक ही काम है. Now, when we were having our MRI signal getting generated, anywhere you have iron, anywhere you have other things, will disrupt it. Okay, yes. So SWI will be seen anywhere you have iron, you have calcium, it will cause this black spot, which is called as blooming. उसको बोलते हैं blooming. Alright, so anytime you want to see micro hemorrhages, इसका नाम हम एक बार लेंगे when we talk about diffuse axonal injury. Alright, so then I will not explain what all these sequences are. Okay, now I'm not going to explain what DWI is. So now you guys remember this for life. So this is DWI, this is SWI. These are the sequences that you need to know. इससे ज़्यादा ज़रूरत नहीं पड़ेगी. So T2 bright, one is fat, one is water. Can I just end story of T2 here? Yeah, no, SWI is not T2. SWI is a different sequence. We can also call it a gradient sequence. So अगर आपके exam में SWI is not given, gradient is given, you can also mark that, or it can also be given as a T2 star. Even if it is not exactly T2, but it can be given a gradient. So it is a T2 star sequence. Okay, right? All right. So now going back to what all things are T1 bright, and this is going to be a very important list. It has been asked also. All right. Nothing else, Shruti. Just remember hemorrhage. Just remember any kind of hemorrhage will be seen on SWI. Very good. One is melanin. So can I say any melanoma will be T1 hyperintense? Yes. What about all kinds of proteins. Can I say all kinds of proteins are gonna be white? So can I bring, rather than going through it again, can I say ये सारा जो diffusion restriction का list था, all of these is gonna be white? Can I say that? Epidermoid cyst, T1 hyperintense, cholesteatoma, keratocystic odontogenic tumor, everything will be white? Yes. So anything which is rich in keratin. Then can I say posterior pituitary has a lot of neurosecretory granules. So posterior pituitary hotspot will also be seen, right? Apart from that, yes, one of you is saying subacute hemorrhage, which is great. So subacute hemorrhage is also T1 hyperintense. And what is the contrast material? What is the contrast material? Gadolinium. So Mackie is asking कि ये सब white ही है T1 पे, तो why do we need diffusion? But are you seeing there are so many other things also which are white? Yeah. So then don't you want to distinguish? So when I find that it's keratin also, it's T1 bright also, and it's diffusion restriction also, then I can characterize, right? Then I know for sure that it's indeed a keratinous material. Got it, everyone? So this is about T1, T2 and MR thumb rule. So now going on to MR thumb rules, the beauty of MRI is that it has the highest resolution, the best kind of images. See for yourself, when I show you CT and MR, किसमें better दिख रहा है brain? Tell me, where do you see gray white matter differentiation better? Obviously in MR. So can I say anywhere when I want to see precious brains, precious nerves, all right, all your central nervous system and peripheral nervous system, my answer is always going to be MR. Yes. So brain and spine tumors, neurogenic lesions. What happens in Pancoast tumors, guys? Does it involve the brachial plexus? Is it a nerve? So again, central nervous system plus peripheral nervous system. Posterior mediastinal mass. Why? What is the most common posterior mediastinal mass? Neurogenic tumor. Again, can I say it's because of the CNS PNS? Yeah. So can I also write here that the investigation of choice for anterior mediastinal mass is going to be what? It's going to be a CCT. Remember, that's going to be a contrast enhanced CT. All right. Okay. What about acute SH? Why have I written chronic SH? What is acute SH? Acute hemorrhage. Anything acute hemorrhage? NCCT. Right. So here for chronic bleed, I want to pick up on MRI. Need an MRI. Diffuse axonal injury. What is the sequence you will do? Tell me now. You guys are wiser. Yes, susceptibility weighted imaging, sequence of choice. मुझे investigation नहीं, I'll tell you sequence also, right? Most sensitive investigation for ischemic stroke. Here also, I don't want investigation. Tell me sequence of choice. Yes, diffusion weighted imaging, right? So it can detect as early as 30 minutes after stroke, all right? Is this fine, everyone? Thumb rules for MR. Where do we need CCT? So remember, CCT or contrast in general, if I have to tell you, when would we give contrast for CT, for MR? Answer will be any time I want to pick up any tumor, anytime I want to pick up any infection or inflammatory pathologies. Because what do all of these do? Do they cause necrosis? Do they invade surrounding soft tissues? Right. So if I give contrast, I can see what is alive soft tissue, what is dead necrotic soft tissue, right? Plus I get a paradigm. This is a vascular tumor, this is a not so vascular tumor, so I can characterize it better, right? So that is why any of these conditions, you do a CCT, you do a CMR. Got it? So now when I ask you investigation of choice for brain tumor, tell me your answer. Perfect answer, you tell me. Contrast enhanced MR, non-contrast MR, CT, NCCT, CCT. Very nice. So brain tumor, brain का MRI हो गया, tumor का contrast हो गया. So can I say contrast enhanced MR? Yes. Are you guys?